You're watching Fox 13, the most powerful name in local news.
He was told to expect 5 years, maybe, if everything went well. Well, that was 25 years ago, well beyond the norm. Heart transplant recipient Frank Sperlin is now a grandfather of 4 and one of only 10 people in the whole world to live that long after having a donated heart implanted into his own chest. And we are happy to say that Frank is well enough to be here today, along with his wife Marie and the surgeon who performed the transplant at Tampa General Hospital, Dr. Vijay. Thank you for coming in.
It's good to be here.
It was 25 years ago. I can't believe it's been that long. Frank, it was 40. You were 42 at the time. What was wrong with your original heart at that point? You were at death's door.
Right. I had taken adriamycin to treat the cancer that I had in my leg, and it produced adriamycin-induced cardiomyopathy, which destroyed my heart.
So basically the muscle itself was not working properly, and it was not pumping the blood that was necessary.
Right.
Dr. Vijay, how is it that Mr. Sperlin has lived so long for us to talk about it and brag about it? We didn't expect this long, did we?
Well, first of all, he's a very good patient, and he has a very good family support. He follows orders, he takes care of himself, he takes the medications on time, and he follows up all the post-transplant workup and the newer medications to fight the rejection, where there's a lot of improvement in the anti-rejection medications. And plus, I think there is a biologically inherent factor in him that somehow or other, the HLA matching, that human leukocyte antigen matching took place with the donor heart. That be the secret. His body has accepted it, and it says, look, you're part of me now, and we're going to get along.
Marie, Dr. Vijay touched on the need for family support. You were there, you were at the hospital the day the operation took place. 25 years later, you're still supporting your husband. So you have to take a little credit.
Thank you. It takes a lot of people to help a transplant get through those first few years.
And even beyond, though, you have to remind him when there's a doctor's appointment, when he needs a little extra medicine or something, right?
We make sure that medicine is taken on time and all doctor's appointments are kept.
You had an average life expectancy is just 5 years. They have improved on that then. Is it still 5 years?
Not dramatically. I think 5 year survival is up to 85% now.
Okay.
1 year survival is almost 90%. The surgical techniques have improved. The preservation of the donor heart, you know, even though you have the 4 hours time, by the time we take it out from the donor to put in the recipient, the time has been extended a little bit now. So we have better preservation technique. And now I believe 10-year survival is over 65%.
Frank, did you ever meet the donor's family? And do you think about what the donor did for you almost every day? Is that sort of an everyday thought that comes into your mind?
I never met the family. I got to talk to his mother and to his fiancée. But, excuse me, it's a constant reminder when I see my grandchildren, or I look out there and now I watch the birds and everything else that go by. It's a constant reminder that I was at death's door. Now, Dr. Vijay didn't go into the final details, but I was down to the minutes. And now here it is, 25 plus years later, still going strong. I basically do anything and everything that I want to do. And to have that opportunity, it's hard to explain. It's hard to put into words. It's the gratitude and the thanks that I have that someone thought far enough ahead to plan. And this is something that I would encourage every person to do. Be an organ donor or a donor, period. The life it's given me, I don't have the words for it. I just can't explain what 25 years of enjoying it to the utmost.
I'm sure your grandkids feel the same way, and who knows what's next in your future. You've survived this, you survived cancer, so you have a long way to go. Thank you, the three of you, for coming in, Dr. Vijay Marie Sperlin and recipient Frank Sperlin, may I. Thank you very much for being here. We appreciate it. And we'll be back with our jobs expert. He's up next, and he's talking about your salary. We'll be right back.